Hi again. So just getting back to my slides, I get talking and didn't even flip through my slides. We pretty much got right to the end. We covered the history, as I said earlier, the asylums and the institutionalization was all sort of taken as unethical practice and really inappropriate, not an effective way to treat them. So reforms meant that we closed big institutions that look like this. This one was in Saskatchewan. And we moved to a more community-based model. I talked about psychoanalysis and psychotherapy, some of the Freudian approaches of the traditional, couch and patient with the armchair psychologist. I didn't speak about transference, and that is something I should touch on. I believe there's one question on your quiz. And basically it's when emotions are transferred between clinician, therapist, and patient. And sometimes we'll project feelings. If it's a female-male relationship, the female client may feel emotional attachment. If there are sort of father-daddy issues, may project those feelings onto the male therapist. And there's also countertransference, where the male therapist might transfer some of their emotional feelings and kind of cross that boundary of feeling like the patient is like a daughter, a child to the therapist. So transference is really when emotions really cross over the boundary line that should be well established between therapist and patient. So that's what that's about. As we progress through, I talked about client-centered therapy, which is the real humanistic approach of being respectful and warm and really putting the client first. Skipped over some of the other types of treatments so that we could get into CBT, cognitive therapies, as well as cognitive behavioral therapy. And I'm wanting to go, there's the two that are on your test, cognitive behavioral therapy, as well as dialectical behavioral therapy, which you're going to compare and contrast on your test. Sometimes therapy can be done in groups, family counseling, couples counseling, or, open groups of social support. Alcoholics Anonymous and Narcotics Anonymous are often done in this way. There are other types of support groups for men who exhibit domestic violent behaviors, or women often will do group therapy at transition houses. And there's a lot of benefits to those. It's more economical in terms of one therapist and 6 to 10 or however many clients. A lot more can be done with a lot less resources, especially how limited clinical therapists are. Mutual support, mutual understanding, shared experience, learning from one another, offering reassurance and support to one another, as well as offering hope. Those are all some of the benefits of group therapy. Obviously, there are some disadvantages as well. Not everyone is comfortable and willing to disclose in a setting like that. Not comfortable sharing their feelings at a level like that. And it could go sideways if the group members aren't supportive or compassionate. So that's something to, keep in mind in terms of the benefits and negatives of both. Does psychotherapy work? Does a therapy like CBT work? So the research says, and by research, they call it meta-analysis. And meta-analysis just means, an average or a combination of lots of individual research studies. So if a researcher is doing a meta-analysis, they do a huge literature review and gather up all of the research that they can find on a subject that's been done already. And then they look at what all of the findings said in order to draw conclusions. And basically, it is an effective treatment. CBT, psychotherapy in general, CBT specifically, is effective. Certainly, people who experience psychotherapy fare better than people who receive no treatment, but it is not effective for all disorders and all illnesses. Psychoanalytic and client-centered therapies really serve people who are well-educated, verbal, and highly motivated because they can work through their problems and their anxieties and help learn to cope with interpersonal relationships. People who suffer from anxiety, somatoform, bulimia, who have anger control issues and general stress, they do the best with CBD. But something like schizophrenia doesn't do as well with CBD, as I mentioned in my first video. Sometimes when you have significant mental illness, one of the best approaches is a combination of therapy and medication. Often having both together will be more beneficial than one alone, especially for things like depression, schizophrenia, illnesses that have a strong cognitive connection, mental connection, neurotransmitter connection. So I'm going to talk about that in a minute, but it helps sort of regulate the disorders more. Exercise and all the other stress moderators we learned about in chapter 10, I believe it was, those are all beneficial too. Exercise oxygenates the brain, getting outside, getting good light exposure, can really help boost how we feel and how we respond to our environment. Those are all excellent treatments too. Those are some of the individual types of psychotherapies that are most effective for certain conditions. CBT, cognitive behavioral therapy, works really well to help people understand how to do things differently and how to look at things differently. Bulimia would be a good example of that. Bulimia or anorexia, helping you understand that you aren't healthy and that your perceptions and your perspectives and your emotional attachment to food is, not benefiting you. And a clinician can really help slowly and progressively work through the relationship and the way people think about food and think about their physical being. I don't want to get into that. I just wanted to wrap up. Let me just look at my notes for a quick second. Wrapping up the chapter on treatment. One sec. The other piece of positive psychology, which is briefly mentioned in your textbook on page 352, positive psychology, is about positive thinking, positive experiences, social connectedness, feeling part of a group, feeling included, a sense of purpose, sense of belonging. It can boost those positive emotions, and people need that in order to combat depression and anxiety and stress. So all of that is also very important in terms of the spectrum of how treatment is done. The last piece of the chapter I wanted to talk about are the drug therapies beginning on page 354, biological therapies. Some conditions cannot just be altered by think through it differently, behave differently, be positive. Some require a more intensive approach. And so that's what I wanted to talk about next, your biological therapies. And those will help adjust the structure and the processes in your brain from a central nervous system perspective as well as from a neurotransmitter perspective. I won't talk about electroconvulsive therapy or psychosurgery. I'm just going to focus on drug therapy. So some of the main drugs, something like an anti-anxiety, like a Valium, they're known from a class of drugs called benzodiazepines. And they're usually prescribed for general anxiety or panic attacks because they increase your sympathetic nervous system, your response system, your alarm system, so that you can basically feel a little less anxious, supposed to induce feelings of calm, helping people feel like they can cope, lowering the respiration rate and the heart rate, and reducing tension. Tolerance does build very quickly, though, so dosage has to be monitored closely by a medical professional. And sometimes the side effect is feeling sedated, drowsy, sleepy, and can also, if you go off them, you have a chance of having worse anxiety symptoms known as the rebound anxiety. So it gets worse when you discontinue the drug. So that's one example of the anti-anxiety class of drugs. Let's see, the antipsychotic drugs, which are prescribed to deal with psychoactive kind of behaviors, to treat depression. They often are known in the class as tranquilizers, often used to treat schizophrenia as well, the antipsychotics, and the antidepressant pills. The antipsychotics help reduce agitation, delusions, and hallucinations, and they do that by blocking dopamine receptors in the brain. If we have an overstimulation of dopamine flooding our synapses, an overactivity. So antipsychotic drugs will help tranquilize some of that and do some blocking of the dopamine so that we don't have as much. The antidepressants, we've talked about those medications before, the SSRIs, the selective serotonin reuptake inhibitors, things like Zoloft and Prozac. They are used to stimulate serotonin levels, increase serotonin levels, and keep the serotonin in the synapse longer. Keeping the serotonin in the synapse between the two neurotransmitters longer helps you to feel more relief, more calm, more positive emotions and positive feelings, to really combat some of those irrational negative beliefs and thoughts. That serotonin being blocked from being reuptaken too quickly and leaving it in the synapse can help you feel a little bit more positive and have better coping skills. And last but not least, lithium. People who have bipolar disorder need to be on lithium, usually indefinitely. There are side effects, which is why a lot of times they don't like to be on them. Also, they start to feel so much better, and then they might think they don't need it. But it is the primary drug used to treat things like bipolar. So that takes us, I believe, to the end of the things I wanted to talk about. There's other treatments that I said I wouldn't get into because they are more in-depth and not as commonly used. But as I mentioned, never underestimate the value of good talk therapy, a good social support system, healthy habits of exercise and nutrition so that your brain's getting nourished and oxygenated the way it needs to be, mindfulness, being present. I'm not one to practice meditation, but people do say that it can be very beneficial and healthy. I don't have the calm capacity to focus the way that others do to make that a success. A good support group is often the most therapeutic thing that all of us need, someone to talk to, even if that's not a formal relationship. That's why hotlines and helplines have become so popular. Grassroots, community-based help is always there if you need someone to talk to, or if things are feeling a little bit more out of hand, or the need for professional help. Your local mental health agencies, the suicide helplines, the kids' help phones, any EAP services, employee assistance programs, anything like that. Even things like going and getting a massage for me are very therapeutic. And so I think the important thing to know is it should be, a well-rounded approach. One size fits all works in almost nothing. In no situation I can think of that one thing works all the time. That's why the combo approach is usually much preferred. And we all know that our mental health systems are bombarded, limited, and in a lot of ways not able to fill the need. It's a very complex thing, understanding the disorder, getting the right diagnosis, the right dosage, the right med. Very complicated for any professional, and certainly for public health and population health. Having the capacity to serve such a huge number of those with mental illness is really tough. So that wraps up the chapter. I hope this assists you in understanding the bulk of the content and in succeeding in the test. I look forward to your presentations next week to learn a little bit more about the individual conditions that you are working on. Be well, take care, and stay connected. Bye for now.